Hi, everybody. Good morning. Welcome to the Climate Predictive Services webinar. There will be some people still joining in, so bear with us if you hear that background noise. But on behalf of the Regional Environment Hub for Central America and the Caribbean, the State Department of International Health and Biodefense, and the National Oceanic and Atmospheric Administration, NOAA, as it is referred to using its initials, we want to thank you for your interest in today's presentation. My name is Tonantzin Juarez, and I work at the Environment Hub and will be your moderator for today. We have people signing in from all parts of the world. I have seen Paraguay, I've seen Argentina, Ethiopia, UK, and a lot of people joining us from the US. Thank you so much. We hope you enjoyed today's presentation and the information our speakers will share with you. Today's presentation covers climate services for health as a tool for governments and communities to predict when outbreaks for vector-borne diseases such as dengue may occur in specific geographic areas. Our goal today is to provide an introduction of what climate services are and the benefit these services can provide for public preparedness for infectious disease outbreaks at the local, national, and regional levels. We hope today's presentation will spur systematic and collaborative approaches, not just with the institutions our presenters represent, but also among you, our participants today. So please don't be shy. Continue to share in the general chat where you're joining us from, and maybe also share a little bit of what area you work in. But thank you so much so far. The general chat has been very active. We also hope that today's presentation opens a conversation that can lead to increased technical and scientific capacity to prevent, detect, and respond to infectious diseases outbreaks such as dengue by using the climate services for health. Well, let me see, where else are participants joining us from? I see Costa Rica, thank you. We're actually big in Costa Rica, our hub. So seeing a lot of participants joining us from here is also very exciting. Peru, I know a lot of people register from NAMBRU, so it's exciting to see you here. So thank you once again. And how do you say so? But how about we just get started? Just some housekeeping items. We do have Gabriel from the hub monitoring the general chat. If you have any general questions for our speakers, we encourage you to please ask questions, and we will make sure we ask them during the Q&A session. And in the event we have a lot of them, do not worry. We will follow via email next week. So we will have two presentations today. One from Hunter Jones, he's from NOAA, and Dr. Paola Vasquez, along with fellow research colleagues from the Center for Research in Pure and Applied Math, CIMPA for its acronym in Spanish, which is housed at the University of Costa Rica. As I mentioned, we want to encourage everyone during these presentations to ask questions. Don't be shy today. So how about we introduce our first speaker? Oh, and just one last note, we do ask that everybody keep your microphones off, just to facilitate a smooth webinar and out of respect to our presenters and also the other participants. So let's get started. Let me introduce our first speaker. Hunter Jones is the Climate and Health Project Manager within NOAA's Research Climate Program Office. Hunter leads the CPO's Extreme Heat Risk Initiative team, focusing on enabling cities to monitor, model, and predict urban scale climate, and applying this understanding to informing and evaluating risk-reducing decisions in urban areas. His other major focus is on improving modeling for infectious and vector-borne diseases using climate information and services. Hunter, can you hear me?
Yes, I can. Can you hear me?
Okay, thank you. So the floor is yours.
Okay, thank you. Thank you for the nice introduction. Let me see if I can get my screen sharing. Okay, can you see my slides?
Yes,
Yes.
we can.
Great. Okay. Thank you. Why don't we get started? So I'm going to first talk about, provide kind of a backdrop for what we mean by climate services, how we characterize climate services, and then really looking forward to the next presentation too, which will give you a much closer kind of zoomed in view of climate services for a particular health application. So in my presentation today, I'm going to spend a significant amount of time talking about climate services and just kind of characterizing those. Then I'll go into how we model, how climate services and modeling of vector-borne diseases can be brought together. And then I'll end with some practicalities that should be considered when developing an early warning system for a climate-sensitive disease. So I like to show rather than tell when I'm presenting something. So I'll show a few examples of what we might consider climate services. And the first one is climate information products. So this is a US seasonal drought outlook that's prepared by NOAA's Climate Prediction Center. And this is a pretty typical product you would get out of a climate service. It's showing a map, and it's showing, in this case, qualitative rather than quantitative information. So it's a nice example that shows that we don't always just provide quantitative information. And it's basically characterizing the risk of drought across the United States, whether drought will persist, remain but improve, remove, or develop based on these color codings. And it's valid for February 18th to May 31st. So it's this kind of climate timescale, a longer time period that goes out several months as opposed to a shorter time scale weather prediction, which also might come from NOAA. Another thing that we might consider a climate service is providing data. This screenshot is actually from a fairly new page that we developed on climate.gov as a result of the COVID-19 pandemic. We noticed a lot of people were doing environmental modeling coupled with modeling COVID-19. So we developed this page to provide easy access to environmental data sets that are useful for disease modeling. So it provides access to temperature, humidity, ultraviolet data sets, and a number of timescales. And so that's another form of a climate service. And this is a good resource, this page, that also has information on different kinds of data sets and how you might use them. Another really important point when we're talking about climate services is user engagement. Easier said than done, but this is really essential, and this is just a picture from a workshop that we did in Massachusetts on extreme heat. But really developing climate services hand in hand with the intended users, getting to know them personally, getting to know their jobs, their decisions that they make, where they find challenges, and the environmental information that can be coupled with their decisions that can help ground their decisions and provide additional information is really essential, and being explicit and mapping it out as we were doing here in this workshop. And I'll show you another example of that in a little bit. So now that I've shown, we can step back and characterize climate services with some formal definitions. I like this paper from Nature Climate Change. It provides a couple of definitions, one from the World Meteorological Organization. They provide climate information in a way that assists decision-making by individuals and organizations. A similar definition comes from the American Meteorological Society. They consider climate services scientifically based information and products that enhance users' knowledge and understanding about the impacts of climate on decisions and actions. So really, I underlined here some of the important key concepts and essential elements of a climate service. Often climate services are defined as kind of a stretch from weather services. So most people are familiar with a weather service, with a weather forecast. And so it's easy to describe climate services in that vein. And so, weather services focus on provisioning scientifically robust products. They focus on operational considerations that sometimes can be constraints. So you really have to make sure that what you're providing is consistent, is reproducible every day, maybe every hour, or every 4 hours, depending on what you're producing, and generalizable. So, I mean, we go back to a map like this. This climate information product is applicable to a number of different kinds of decisions. It's not really tightly tailored to a very specific decision. And that's kind of a characteristic of weather information too that's typically provided, is they have a lot of different applications. Increasingly, social science understanding of the way that users interpret those forecasts is coming into play, which is really important. It's driving a move towards impact-based forecasts. So instead of saying it's going to hail tomorrow or it's going to rain this many centimeters, you might instead say what the impact of that will be. You know, the hail could cause significant damage to exposed, rooftops and vehicles, and so going a little bit further down that impact-based path is now where we're headed in NOAA, based on our understanding from social science. And there's a strong focus on timescales, and I'll touch on that a little bit more in a moment. But I also like to provide as a contrast the idea of ecosystem services, which is very different. Well, not very different, but it's another way of framing, thinking about climate services. And so ecosystem services are, of course, valuing the services that are provided by a functioning ecosystem. And I like thinking about climate services in this way too, because ecosystem services are just a slightly different, kind of viewing that service from a slightly different angle. So how is maintaining the functioning of an ecosystem or a climate system, whether it's the global climate system or even a kind of a local microclimate, what services does that provide? And what can we do to monitor and to really value those services? And it also kind of lends itself to more of an Earth system framing. So instead of dividing up kind of a hard contrast between weather and climate, I like to think of them as one kind of really emanating from the same Earth system and from our ability to model that. So now I want to go into a few of the characteristics in more detail of climate services. And so this is kind of taking from, this has been a diagram on the right that's been done in many different ways. There are a lot of different versions of this. But what it's really showing you is that often if you're taking a weather service framing or of climate services, you might divide up weather and climate services based on timescales. But we actually like to think of them as being sort of integrated and being this continuous, we like to provision continuous services, a continuum of information from weather and climate timescales. And these get a little bit blended in the middle, and it's actually a little bit challenging to work at that intersection. So weather forecasts are typically deterministic. We're telling you that we're expecting it to rain 2 centimeters tomorrow, or something like that, or the high for tomorrow is going to be this. Whereas climate scale predictions tend to focus more on probabilistic information. So giving you more of an estimate of the likelihood of being in above normal temperatures. And so this is partially because that information is coming from different data sources. So initial conditions of the atmosphere is really what helps us predict the weather. But other things such as knowing the state of ENSO, of whether we're in an El Nino or a La Nina, are helpful for these longer timescales. So bringing that all together is really important. And an important part of the climate service is kind of integrating those timescales to provide this seamless information. And it's really supportive too of the emergency management emergency management cycle, which you can see on the left. And that's sort of this continual loop of mitigating risks, preparing for them, responding when you know that they're about to happen, and then recovering from them. And that's a loop, of course, because we want to learn from our experience as we handle those risks. And so when we're providing climate services, we like to think about this timescale, and this is applicable to managing disease outbreaks as well. We like to provide information that's sort of available at all of those different stages in that cycle. Environmental data sources are also something that are really important, and you'll hear about these a little bit more in the next presentation. They all come with their own pros and cons. This is not a complete list of environmental data sources or of pros and cons. I think most people are fairly familiar with satellite and in situ observations, but something I do want to touch on are reanalyses. These are less well known, but effectively, satellite remote sense data is nice because it's easy to get a gridded data set. In situ observations are nice because they are a source of truth measurement, but they tend to have sparse distribution across the globe, and some places have more observing stations than others, which can present challenges. Reanalyses are nice because they are comprehensive climate monitoring data, and they're produced by taking observations like those you see on the left, like satellite remote sensed observations and in situ observations, and running a climate model to kind of you're driving the climate model with those observations, and you're using what we know about the climate system to fill in the gaps and provide a smooth gridded surface of environmental information. And it's I think reanalyses are underutilized. They're not known about by a lot of people. So I think that's an interesting thing to consider. And the last slide in the climate services portion of the talk is on user orientation. Save the best for last. I think this is really important, and it's really hard to do well. There are a number of tools that we use. Decision calendars are one. You might conceive of them as boundary objects, which is a little bit esoteric. Use cases. There are a lot of ways that you might describe these, but essentially what we're trying to do is to provide a timeline that is explicit in terms of the timing of when decisions have to be made to protect people from a particular hazard. In this case, we're protecting them from heat. Be explicit about the users or the decision makers. So here we've got an emergency manager and an urban planner. And then they also kind of map out what those decisions are, when they're made, and then the environmental data on the bottom here that supports that decision making. And so developing these sorts of products with your users is really essential. Kind of bring them along with developing the climate services for health, for heat, or for disease prediction is really important. Okay, now I'm going to transition into something more specific on vector-borne disease, and once again show you an example of climate services for health. This is a product that was partially funded out of the Climate Program Office by the International Research Applications Project. It's been developed through a lot of partnerships, as you can see in the upper right. And what it's called is ChikRisk, and this is just a screenshot from the website that you can go to in the lower right corner. And it's predicting chikungunya risk using machine learning methods that are applied to environmental data, precipitation and temperature, demographic information such as population density, as well as vector distribution and historical occurrence of chikungunya. And it's providing a quantitative risk assessment here on the lower right corner. You can see that it splits it up into ranging from 0 to 1, sort of categorizing that risk as suitable, low, medium, and high. And as you can see, Costa Rica and a lot of Central America are pretty red here in the high category. So this is what an output from a climate and health service might look like. And this is an experimental research project. How do we get there? Well, it's important to understand that what really enables us to use climate services as one of the elements that goes into predicting diseases is that vector-borne diseases, such as what I'm showing here, West Nile virus on the right, and I'm also showing you tularemia transmission, they're really tied to the environment, because you have a number of different hosts and vectors. You have all these animals and their life cycles that are important in transmitting these diseases. And so the tularemia example is just to show the kind of a complex example of this pathogen having to hop from many different, the ticks have to kind of hop from many different hosts. And so there are a lot of stages on the way to infecting a human with a particular disease that are influenced by the environment. The pathogen can be influenced by the environment. That's going back to my example of COVID-19. There have been a lot of studies that have looked at the effect of humidity and temperature and other environmental factors on the ability of the virus, of the coronavirus, to survive outdoors. And then when you have vector-borne diseases like dengue, like West Nile virus, you have amplifying hosts like birds that have migratory behavior. You have mosquitoes that are very tightly tied to the environment in terms of their reproductive cycles and the rate at which the virus is replicating inside of the mosquitoes, and then ultimately their behavior when they're feeding on humans, the incidental host. And so all of those are kind of linked to the environment. So developing a model for climate-sensitive disease really requires understanding how environmental conditions like those on the left, including those that are kind of secondarily environmental, like human behavior and the way we react to a drought by storing water in cisterns and water barrels, which could provide environment for mosquitoes. Connecting those to these entomological and biological aspects of spreading a vector-borne disease like fecundity and larval development. ultimately what we're trying to do is provide early warning. So this is unfortunately, I think most people in the world are familiar with epidemic curves at this point because of COVID-19. So that sort of a classic example of what that might look like is the red curve, where you have a rise that peaks and then you have it kind of tapering off. And what causes it to taper off often is some combination of, either it's saturation, you have enough people that are getting the disease, or you have interventions that are put in place to reduce the risk of the disease. And I guess what the point of what this slide is really getting at is that with early warning, because we have environmental predictions that can go out weeks, months, seasons, we can get a sense of how the environment might be changing, how that might influence these infectious and vector-borne diseases, and ultimately provide early warning so that we can flatten the curve, something that now people are pretty familiar with. We can actually diminish that outbreak with that early warning. And then you also have to consider the applications. So I talked already about the users. It's important to bring your users along when you're developing climate services for health uses. But it's really important to think about what those applications are and how that environmental information will inform decision-making and inform communication. And so vector control is a common way that people are kind of using this climate information. And so if that's the case for wherever you are, then having vector control along with you, having entomologists along with you as you're developing these climate services for health is really important. And then this is just a really coarse general framework based on what I've just talked about of the components that need to be really in place to have an effective climate service for health, an effective one for disease prediction. And this is also not capturing everything, but I really wanted to draw out a couple of important elements. One is on the left, the decision context, which requires sustained user engagement, requires health surveillance, understanding where the cases are, understanding the decisions and actions that are available to mitigate risk, to reduce those cases. That's all really essential in developing these services. And then also the foundational capabilities on the right, sustained observations. I would love it if we had more, health service providers advocating for more buoys in the ocean. It seems like a stretch, but you actually have to consider how important those sustained observations are for providing environmental services that can be used to develop these prediction systems. So it really does require this kind of comprehensive view of all of these components. Lastly, in the last few minutes, I just want to cover operationalization. What does it take to develop climate services for health? I've mentioned this before, but what's really important, one aspect is really understanding what you're trying to predict. These models can be developed to, and these services, these early warning systems, can be developed to predict a number of different kinds of outcomes that can range from environmental to epidemiological. You can model strictly environmental conditions that might be suitable. You can model entomological outcomes such as life cycle completions. These are just examples that I've drawn from various resources and websites. The third one here, CDC flu site, this is a fun one. Where they have competitions where teams of researchers can issue predictions of the number of cases we might expect for influenza in the US and the probability of the probability of the number of cases, epidemic start, end, peak. These are all the kinds of outcomes that you can model. So just being clear on what you really want to model and what decision it's plugged into is essential. Another quick point to make is that you always get in trouble when you start to break things down into dichotomies. But you might hear this quite often. There are two broad categories of model types that you might experience when you're doing when you're developing these early warning systems. One is mechanistic models on the left, or process or dynamical, and then on the right is phenomenological or empirical or statistical. And speaking in broad generalities here, the main differences are that the mechanistic models on the left really understand the mechanisms and capture those processes that drive a particular condition, that drive the disease outbreak that you're concerned about. it's nice because if you are doing a good job capturing that process and you understand the mechanisms, the model predictions tend to be easier to tie to understanding what you might do to intervene to reduce or diminish that mechanism that's driving that disease. Whereas on the other side, you have statistical models that are really fitting models to data. So they're data driven. They're trying to understand why, based on a number of these variables that you can feed into the model, what's driving the outcome that you're predicting. And what's nice about these kinds of models is that you can keep updating them with new data. And they do a good job capturing, if you have a very complex process that you don't necessarily totally understand the mechanisms for, these kinds of models are really good at still providing predictions, even if the process is a little bit too complicated to really represent in a mechanistic way. Just a couple more slides left. I wanted to collect some best practices here. I think I've hinted at a number of these, so I won't go into details, but these are just some takeaways that I've learned over the years, working on a lot actually on developing climate services for heat and health. But really working closely with your users, knowing them. Jokingly, I put knowing their hobbies, but really being familiar with who's using your products is essential on the left. And then on the right is really just the point I want to make with these best practices on the right is that you need to break out of your organizational molds. I think that's the main takeaway. It's easy to fall into the mission and mandate of a particular agency. Oh, we're an environmental agency, we don't do health, or we're health, we don't do environment. But it's really helpful to have a setting where you can kind of work together collaboratively in that kind of cross-mission space and collaborate to develop these climate services for health. The last few points I'm going to make are that one interesting thing to consider is climate outlook forums as an avenue for providing climate and health services. This is being done more and more. Climate outlook forums have been around since 1997. This is actually from a lot of this information is from a paper that kind of outlines how initially you might not get the predictions correct, and it kind of shows you what it takes to build trust in new capabilities. So that's a good case study just to consider is how in Zimbabwe with the early climate forum, they managed to build trust in their predictions over time. And this is just a representation of where there are, to my knowledge, some climate outlook forums that have factored health in, but there are probably more, and I hope to see more of them in the future. And I'll end by leaving you with this great resource, which is from the WMO-WHO Joint Office for Climate and Health. It's a set of climate services for health fundamentals and case studies. And this is from some of the pages of that resource, and I've highlighted, you can see in the upper right corner, the case studies that have to do with vector-borne disease. And most of them, many of them are focused on dengue. And there are several from Brazil here that's maybe some people on the call even are familiar with. So this is a great resource to familiarize yourself with if you're starting to explore climate services for health. And I will end there. Thank you for your time.
Thank you so much, Hunter, for all the information that you provided us today. I think if you can stop, there we go. Can everybody see me? Yes, okay. No, thank you so much. I think I speak for all participants when I say that this was very valuable and important information to better understand the concept of climate services for health and how we can use them in helping us with surveillance, enabling, as you mentioned, timely vector control, and even allocating the right resources in advance. And I think that's the key. If I speak for a lot of participants, this is about being able to maximize our available resources. And thank you so much for everybody that has been very active in the chat box, not just sharing where you're joining us from, but also sharing your questions. I want to reinforce you that we are taking note of these and we will be asking them at the end of our second presentation. We will have a question and answer Q&A session. So we have not forgotten about you. We've made note of it. note of it, okay? But yeah, so I just want to highlight, do a little bit of the shout outs. We have people joining us from Sri Lanka, from Honduras, El Salvador, Nicaragua. I said from the US, also from DC, New York, Arizona, even Texas, even though there's no electricity. Thank you so much for taking the time. We really appreciate it. And then some of the organizations I do want to mention is, for instance, in Argentina, Fundación Mundo Sano, a shout out from the Department of State, the OES office. Thank you for always supporting us in all of our crazy ideas. From El Salvador, Observatorio Ambiental, thank you so much. From Colombia, we have the Instituto de Hidrología, Meteorología y Estudios Ambientales. So this is a very, very, I guess, diverse audience. And I think this enriches even more the conversation that we can have and we hope to have in the Q&A session. So as I mentioned, if you're just joining us, don't be shy, say hi. Or if you see a friend or someone you know from another country, go for it, say hi. So now, how do you say? So now we go to the next presentation. Our next speaker, I would like to introduce first Dr. Paola and the SIMPA team. The Center for Research in Pure and Applied Math, SIMPA for its acronym in Spanish, is housed at the University of Costa Rica. Today's presentation is a result of collaboration among researchers from this institution, SIMPA. These are Dr. Fabio Sanchez and Dr. Luis Barbosa, both associate professors in mathematics at the University of Costa Rica, and Dr. Paola Vaz, a researcher with SIMPA. They are presenting their work titled Climate-Driven Statistical Models as Effective Predictors of Local Dengue Incidence in Costa Rica, a general additive model random forest approach to retrospectively predict the relative risk of dengue cases in 5 climatological diverse municipalities. Dr. Paola will be speaking on behalf of the team, but both Dr. Fabio and Dr. Luis are with us today. So I encourage them to, say hi, maybe in the chat box, and they will be available to answer any related questions to today's presentation at the end. So I know from the registration data, we have a lot of researchers and a lot of participants that register with a background in academia. So don't be shy about asking any questions once again. I will keep saying this over and over again. So Paola, are you there?
Yes, hello. Thank
Hi,
you.
Paola. Well,
Hi.
welcome, and the floor is yours.
Thank you. I'm gonna share my screen. Let me know if you can see my slides. Can you see them?
Yes, we can.
Thank you, and thank you very much for the presentation today. And thank you very much as well for the invitation to present in this webinar. Today, I'm going to be speaking about our research that involves the use of different climate variables as predictors of local dengue incidents in Costa Rica, and our experience in presenting these results with public health authorities in the country. Starting with a little bit of history of dengue in Costa Rica, the fight against the Aedes aegypti mosquito in the country started with a campaign promoted by the Pan American Health Organization in 1949 in the search to reduce the incidence for yellow fever that was affecting the region during that period. After a series of chemical control campaigns and verification process, Costa Rica was declared as a country free of Aedes aegypti in 1961. However, as it happened with most countries in the region, Costa Rica did not maintain an active surveillance system, and Aedes aegypti was again found in the Pacific coast of Costa Rica. By September 1993, the Ministry of Health was reporting the first dengue cases reported in Liberia and Punta Arenas, which are municipalities located in the Pacific area of the country. Since then, dengue cases have been documented annually, and the prevention and control strategies have been adapted to both national and international guidelines and recommendations. Well, in this graphic, you can see the number of dengue cases from 1993 to 2020 in Costa Rica. peaks of transmission dynamics are in Costa Rica. Peaks of transmission dynamics are observed every 2 to 5 years, similar to other countries in the region. Costa Rica has experienced its largest outbreak in dengue cases in 2013, with almost 49,000 reported cases. And in 2007, Costa Rica experienced its largest outbreak in severe dengue cases. However, as you can see, mortality rate in the country remains very low. As far as for dengue virus serotype, in 1993, with the first cases, dengue virus 1 was introduced in the country. The next year, dengue virus 3 was introduced. And by 1999, dengue virus 2 started circulating Costa Rica. As far as for dengue virus 4, despite some sporadic cases reported mainly in 1993, the Ministry of Health has not reported an active circulation of this specific serotype within national territory. In this short animation, you're going to see the geographical distribution of dengue cases in Costa Rica throughout these 27 years since its introduction in the Pacific area, in the North Pacific area of the country. Historically, the coastal regions of Costa Rica has been the most affected. However, as you can see in this short video, incidence varies year for year, with one year affecting more the Pacific coast, the other year affecting more the Caribbean area of the country, or the southern area of Costa Rica, which poses a challenge to public health authorities to effectively allocate the available resources every year, right? So the variations in this geographical distribution and incidence observed each year is influenced by the complex interaction of multiple factors, right? Among them, urbanization. There are several areas in the country where social determinants make it very difficult to effectively control possible breeding areas. Local immunity patterns, depending on the circulation of a specific serotype within a specific region in Costa Rica. Human mobility also plays an essential role in dengue transmission dynamics. During 2020, public health measures implemented due to COVID influenced greatly human mobility patterns as more people stayed home. This is interesting because, well, in an article published in 2019, we were able to observe through an ABC approximation model that the risk of Zika was rated among population that spent most of their times inside their homes. So it's going to be interesting to see whether or if public health measures to COVID had any play or factor in Aedes borne diseases during 2020 and 21. Also, vector control is essential in Costa Rica. As in most countries of the region, vector control relies on chemical control campaigns, entomological surveillance, and community engagement. In 2019, the opportunity to accompany the Ministry of Health, as they explained to us one of the methods that they use in entomological surveillance in the country, as they use OB traps located in different areas of municipalities with endemic circulation of the virus, and they monitor the prevalence of the mosquito. This is very interesting because everything helps, right? When we are researching these types of disease, to better understand how the Ministry of Health use prevention and control strategies. Also, one factor that is very important to have monitor is insecticide resistance, as chemical control is one of the main sources of control right now. The University of Costa Rica, there has been some researches where some kind of resistance have been found in different areas and to different components of insecticides. So this is something that needs to be monitored very closely. And of course, climate plays an essential role in the transmission of dengue. dengue is a climate-sensitive disease where variations in temperature, relative humidity, precipitation, all of them which is affected by El Niño Southern Oscillation, affect each of the epidemiological components of dengue transmission, such as the vector, the host, as it affects human behavior, as well as the virus, as variations in temperature affects the periods of extrinsic incubation period inside the mosquito. This ultimately has an influence in the geographical distribution, incidence, and seasonality of the disease, right? So as the transmission dynamics of dengue are intricately linked to the interplay of multiple meteorological conditions and recently significant advances in climate data availability, statistical modeling, and information technology has increasingly opened the possibility of using climate information as effective predictors of dengue incidents in different areas of the world. However, in Costa Rica, a tropical country with optimal conditions for mosquito survival, the extent of influence that different climate variables have on local dengue epidemiology is something that is an area that is starting to be analyzed, right? In this image, you can see the different climate regions of Costa Rica. There are 7 main climatic regions for Costa Rica. Each one of these regions, however, is further subdivided into subregions, each one with their own specific patterns in temperature, precipitation, humidity, which makes Costa Rica a country with multiple microclimates separated by short distances, enhancing the need to include climate information in the development of local control and prevention strategies. As in this context, and as the World Health Organization and others have advocated, there is an increasing need to include climate information as part of a comprehensive early warning system in Costa Rica as well, as part of the national policy adaptation to climate change. An early warning system from the Ministry of Health that detects the incidence of human disease related to climate variability and change is essential, right? So in an effort to better understand how climate affects different regions in the country and its possible use as an additional tool for public health authorities in the country, we used the number of dengue reported cases and climate data from 2007 to 2017. And we fitted a prediction model applying a generalized additive model and random forest approach, which allows us to retrospectively predict the relative risk of dengue in 5 climatologically diverse municipalities around the country. As for the study areas, of the 82 municipalities located in the country, we selected 5. We wanted to select municipalities that were in different climatological regions of Costa Rica to see how the models behave under different conditions, as well under different social characteristics of each municipality. Each of these municipalities has different microclimates and have endemic circulation of dengue virus. The first 2 municipalities, Liberia and Santa Cruz, are located in the North Pacific region of the country. This area of Costa Rica is characterized for being very dry and very warm. During El Niño season, Liberia and Santa Cruz are very prone to extensive dry conditions and droughts, which affects the economical behavior of these areas, as areas rely very much in agricultural activity. Also affects the availability to get water, and people started to resell water, which creates the possibility of breeding sites, right? Buenos Aires is the municipality that we chose in the southern area of Costa Rica. This is one of the most rural municipalities in our study and the least densely populated. Liberia is located, as I said, in the South Pacific area, and is characterized by having a short dry season that goes from January to March, and an extensive rainy season from May to December. Alajuela is our municipality in the central area of Costa Rica. This is the most urban area of the selected areas that we used, and is the most densely populated. Alajuela is very dry and very warm, as a characteristic in the climate conditions. And finally, Limon is the municipality that we choose in the Caribbean area of Costa Rica. It has very different conditions as the rest of the municipalities that we choose. As located in the Caribbean region, it does not have a specific dry season. It rains throughout the year, with specific months that are most dry than others, but it has a very rainy pattern. As for our dependent variable, we use the weekly dengue cases from 2007 to 2017. This information was provided by the Ministry of Health in the Department of Health Surveillance. We calculated the relative risk of each of these municipalities for each year. And as you can see, dengue transmission dynamics in each of the municipalities that we choose is very different. Even Liberia and Punta Arenas, that are municipalities very close by, you can see peaks of transmission dynamics and events vary from one municipality to another. As a climate information, we use the climate variables of mean temperature, precipitation, and relative humidity. The information from these climate variables was obtained from the National Meteorological Institute of Costa Rica. They provided us with information from 5 of their meteorological stations, each one located in the municipalities that we selected, which had information from 2007 to 2017. We also use weekly temperature from, the sea surface temperature anomaly in the 3.4 region from data from NOAA. As well, and in order to include more information about past behavior of the variables, we calculated the largest cross correlation among the observed cases and each of the climate variables that we selected. The results that you see here are the number of weeks that takes to a specific climate variation to affect the mosquito, to affect the life cycle of the mosquito, to affect the breeding areas, or the ability for breeding sites, as well as the subsequent clinical manifestation, as well as the subsequent extrinsic incubation period inside the mosquito, and the subsequent clinical manifestations that results in the consultation to healthcare services and is later reports by the Ministry of Health. These lag periods were later used in our models. So based on the relative risk, the climate information, and its respective lag period, we implemented 2 prediction models. The first one of them is we use a generalized additive model, which allows to capture the associations between variables that do not follow a clear linear relationship, right? So as you can see in the model is included the relative risk of each of the municipalities, as well as the specific climate variable and its corresponding lag version. We also use a random forest, which is a machine learning algorithm that allows the construction of multiple decision trees with the Tectonic data. As I told you later, we use 2007 and 2016 information, both from climate to dengue data information as a training data for both of the models. And we use that 52 weeks of 2017 as a testing period for the prediction capacity of each of our models. As for our results, we were very surprised by a result. We weren't expecting as much because we were using only climate variables, but well, what you're going to see here is the results first for Alajuela. As you remember, Alajuela is a municipality located in the central area of Costa Rica, very dry, very hot, and very densely populated. What you can see here is the relative risk and 52 weeks of 2017. The solid line is the generalized additive model, and the dotted line is the random forest model. The dots are the relative risk as reported by the Ministry of Health during that year. Alajuela, as you can see, had very good, the models were able to capture very well the tendency of this specific municipality. As you can see, the model captured very well how the decreasing trend, as well as areas where incidents increase suddenly, like here and here. And as well as at the end of the year, how relative risks significantly decrease. Buenos Aires is our municipality, as you remember, located in the southern area of Costa Rica. Buenos Aires is really interesting because despite having all of the conditions for dengue circulation, the first cases of dengue in this specific municipality were reported until 2003. So during 2017, Buenos Aires had really low number of cases. As you can see, since the week 0 to since week 1 to week 48, the number of cases remained almost a zero, relative risk really low. However, the model in week 48 managed to capture the increase in relative risk during this period, both the generalized additive model as the random forest approach. Limon, as you remember, is our municipality located in the Caribbean area of Costa Rica. The model also, both models also capture very well the tendency in this municipality. As you can see, we managed to capture the tendency of decrease as well as subtle increase as it happened in week 47. The model was a little bit lagged with the actual event. However, it was a really good result, we think. However, and this is really interesting because the model managed to capture very well the tendency in all of the three previous municipalities. However, in our municipalities located in Santa Cruz and Liberia, which, as you remember, were located in the northern area of Costa Rica, it changes, right? In this case, the model overestimated the relative risk in many of the weeks, both in Santa Cruz and in Liberia, right? As you can see, relative risk, observed relative risk for the Ministry of Health was really low during, especially in Liberia, during the first weeks of 2017. However, we managed to capture some of the increasing tendencies like in these periods in Santa Cruz. So we started thinking about possible reasons why the model behaved different in these specific areas and why we weren't able to capture the tendency. Some ideas came to our mind. Well, Santa Cruz and Liberia are communities in Costa Rica, municipalities in Costa Rica, which dengue has been extensively affected the community for years. As a matter of fact, you can ask people in Santa Cruz and Liberia, and they're gonna tell you, oh yes, I have had dengue like 2 times by now. So sometimes they don't go to healthcare services to get diagnosed, and so reports may be down in these cases, Also, Santa Cruz and Liberia are very touristic areas in Costa Rica. They have very beautiful beaches and it are very visited for tourists, both national and international. So there is a possibility that people can get infected in these regions, but are reporting elsewhere in the country or in the respective countries of origin. Also, we search for the reports made by the laboratory here in Costa Rica in charge of arboviral surveillance. And they stated in 2017 that the hospitals in charge to receive the samples taken in healthcare services centers were very low during 2017 in this specific region of the country. They say that during that year, during the entire year, only 15 samples per municipality were sent to them to be analyzed. So they emphasize in the need to speed up this type of surveillance, as dengue is a disease with a widespread and a range of symptoms, right, that can be confused with different other viral diseases. So based on these results and how we can tell these models perform in capturing the tendency of dengue transmission dynamics during 2017 in most of the municipalities in Costa Rica, we had the opportunity to schedule meetings with public health officials in the country. We scheduled several meetings with different actors in the public health area. In this picture, especially, you're seeing how we presented our results to the Vector Surveillance Department of the Ministry of Health. And we had the opportunity both to share our results, to share our experience in gathering the data, as well as as we're starting to talk about the opportunity of further using or including this type of information, of climate information, and especially of local climate information, um, to better allocate the available resources that the Ministry of Health has to fight this disease. There's also a very open they're also very open to using this type of models and to see how they can be included as an additional tool in the already arsenal of tools that the Ministry of Health has in continuous surveillance of the disease in the country. It also opens up the opportunity to include other sectors and to establish a more interdisciplinary approach to a very complex disease. As I stated earlier, where social determinants are crucial, where climate obviously is crucial, where economic aspects are also crucial. So this opens up the possibility to change a little bit the management that we're already having and increasing our opportunities to expand and to better control and allocate the resources that the Ministry of Health has. So right now, these meetings took place during the end of 2019. So we were starting doing some research with them. However, how COVID started, and we had to put a pause on this research as we were helping the Ministry of Health, but with modeling COVID in Costa Rica. So right now we're starting our investigation, and we are exploring the use of different climate variables, such as normalized different water index, sea surface temperatures, land surface temperature as well. As one of the limitations of our model so far is that we relied on observed climate variables, right? So we are now shifting to different climate information, as well as exploring different modeling mechanisms, such as deep learning, neural networks, wavelength time series analysis, as well as special SIP models. And to finish, I just wanted to introduce you to our team. We are 6 members from the University of Costa Rica, from different disciplines, and well, it's really nice to have the opportunity to share our research and our ongoing research with all of you. And yes, I'm gonna finish here. Thank you very much, and all the questions that you can have. We will be gladly to answer to them. Thank you very much.
Thank you so much, Paola, for this presentation. I think I also speak on behalf of everybody when I say that it was very, very insightful. And I also want to thank you for updating us and sharing your experience with working with the Ministry of Health here in Costa Rica. This is very interesting and encouraging to have a close partnership between the university and ministry that delivers benefits for all of Costa Rica. Or as you mentioned, it's ongoing, but it can only go from here to positive things. We have a lot of questions, how do you say, that have been recorded. So thank you everybody that has taken the time to do this. So how about we just get started? So I would like to first go back. Well, before that, I do want to welcome back Hunter Jones. Thank you for this Q&A session, and also Dr. Luis Barbosa and Dr. Fabio Sanchez, who, how would you say, will be joining us. If you would like to, Hunter, Luis, and Fabio and Paola, if you want to share your screen so we can, or not share your screen, how do you say, share your camera so we can see you, and how do you say, and say hi. If not, I guess Paola and I will, well, no, thank you, Dr. Fabio and Dr. Luis, yes, say hi, thank you. Okay, so how about we get started? So I'll go to Hunter and I'll ask the first question. Is it technically correct to use global climate databases and forecasts to develop disease forecasts at the sub-national level? Is it useful?
Yeah, that's a good question. It all really depends on what you're trying to model. Of course, if you're modeling diseases or disease cases that are fairly local, then having the local data would be the most useful, and having a high spatial resolution. Though, I mean, if you're looking at some global climate phenomena, you might consider something like ENSO, like whether you're in a La Nina or an El Nino phase, and those are global climate phenomena that have local impacts. And so, you know, if you're in one or the other modes of ENSO, for example, you might have a warmer or drier, warmer and drier, or cooler and wetter season. So that can still be useful and helpful at a regional or a local level.
Thank you, Hunter. So now I'll ask a question to the SIMPA team. Which agencies and stakeholders should be involved in the establishment and use of health early warning system? What are the key considerations for designing a health early warning system to ensure it is effective and produces user-friendly outputs? So this was addressed to you. So I don't know if Dr. Fabio, Luis, or Paola may want to take that.
Hi, I'm sorry. Can you repeat the question? I had like a little bit of interference and didn't listen well.
So they were asking to the SIMPA team, which agencies and stakeholders should be involved in the establishment and use of health early warning system? What are some key considerations for designing a health early warning system?
Yeah, this is a really good question. And I think that, as I stated at the end of our presentation, I think that in such a complex disease, the establishment of health early warning systems should be an approach that needs to be interdisciplinary and with multiple areas. Like, for example, the Ministry of Health is an essential actor, as well as we think academia are essential actors as well, as they can input some information and increase the ability of information that the Ministry of Health may have, as well as we are going to use climate services. The National Meteorological Institute is going to be essential as well as to be included here. Other agencies, such as in Costa Rica, there's a State of the Union program where they have a lot of information about climate variables, demographic information. It's also going to be very useful to include. So I think this needs to be an interinstitutional and interdisciplinary approach to effectively attack or to effectively abort such a complex disease, right?
Thank you so much for your how do you say, very concise and very insightful response. So I'll go ahead and go back to Hunter. So another question that we have here is, can climate services help us to predict the coastal regions that could be flooded due to sea level rise, and at the same time consider the effects of tectonic uplift?
Yeah, I saw that question. I think it's a little bit outside of my area of expertise, but so I in particular, I don't know what I would say about the tectonic part of the question. But as for coastal inundation, yes, there are climate services that cover that sort of thing. So at least for part of the question, I could say yes.
No, thank you. And I guess for the SIPA team, we have a really interesting question here. So considering population density, population mobility, land use, porous borders, and climate variations, is it possible to eradicate dengue from Costa Rica?
Well, I think that yes, I think Fayo can talk. Fayo, I'm sorry.
Well, that's okay. You can compliment if you like when I'm done. So eradicate probably is a very we would like to, at least in my opinion, I think it's unlikely, because to eradicate dengue means that we have to eradicate both vectors that transmit the disease. In this case, Aedes aegypti and Aedes albopictus, that are both in Costa Rica in most areas. So that's a very difficult problem. However, it's not the goal. I think the smaller goal is to reduce the incidence, which will in turn benefit the population in a broader scale. So trying to reduce the incidence is a smaller goal. I think eradication, I mean, there have been efforts to eradicate back in, in Costa Rica, we were Aedes aegypti free a long time ago. There were some efforts in 1976, if I got the year right, to eradicate Aedes aegypti worldwide, and that failed. So there have been plenty of efforts, but it's not only to eradicate dengue. Dengue is just a virus that is transmitted by this vector. It's to eradicate the vector, which is Aedes aegypti in particular, is very resilient, and it's accustomed to live within households, and it's and even the breeding sites are a challenge, which I think is the main way of attacking this disease, is by looking at the breeding site distribution within particular places, especially in Costa Rica, or in particular in Costa Rica. So I think it's eradication. It's probably not something that I think is possible, at least in the foreseeable future. However, reducing incidence, I think it is possible if we give public health officials sort of an advantage. And that means giving them a few months, perhaps, of telling them, hey, in these areas, the relative risk might be really high. So instead of just giving out resources throughout the whole country, they can optimize the resources, and therefore likely to reduce incidence in many places in the country. I don't know if Luis or Paola want to add anything to that.
No, I think you said everything. Thank you.
Okay, no, thank you so much for that. And I think we've throughout both Hunter's presentation, I think I even commented, and then Paola, now you, it's the allocating the right resources in the right regions, and this is what climate services for health will help us, you know. So then I guess I'll continue with Simpa, because there is a question here that says, how did you define the lag periods of the meteorological variables?
So for the lagged variables, and for the definition of the lag periods, we consider the cross correlation analysis between the climate variables and the incidence of the disease, and we try to choose the larger CCF, which is the cross correlation function, and we followed that kind of idea in order to choose the lag periods.
Thank you for that. So then I'll jump back to Hunter. So in Guatemala, and this is a question on behalf actually of the Meteorological Institute that is working together with the Ministry of Health in the specific area of vectors. They are, well, they say, we're working to predict future outbreaks with monthly forecasts. Is it correct to make the monthly prediction? What is your opinion or advice?
Yeah, I think it can be. It depends on what you're really trying to predict. But I know there are plenty of models out there that go for weekly. There are plenty that go for monthly and even annual. It depends on the data that you have available. I had that slide with all the different outcomes that you could predict. Depends on what you're going for there. But certainly I have seen monthly predictions, particularly if your decision that you're trying to inform is on a monthly timescale, then it makes sense to fit your model to that sort of data. And you might be looking at, even seasonal differences in terms of this may or may not be relevant for Central America, but I know in North America, where winter is a determining factor that kind of drives how severe mosquitoes will be, the intensity of the diseases, and then also the number of mosquitoes that we might have to deal with based on the coldness of the winter and the amount of moisture that's building up. Then the seasonal and monthly information can be quite useful.
Thank you for that. So going back to SIMPA, just because it's also a question related to your methodology, somebody asks, why have you used a generalized additive model and not another one in this particular study?
Yeah, we chose the GIM model as a first attempt to understand the problem, to try to do the prediction during 2017 data. And we also think that the GIM models, they offer a good opportunity to include the nonlinearity on the covariates. So we think that's a good way to start understanding the problem. And we're also considering right now to include some spatial data and temporal covariates in some way, so we can include the heterogeneity of the behavior of dengue in Costa Rica.
Thank you so much for that. And I guess we do have some general questions, and I'll read them out loud, and then I'll let Hunter first answer, and then from SIMPA, one of you maybe provide your insight into this. So they ask, regarding predictive models for countries that have no or low number of dengue cases, autochthonous and or imported, is it better to use predictive models based on mechanisms, processes, and dynamics, or statistical models with data?
Yeah, that's a good question. I think I know I keep saying this, but it kind of depends on what you're trying to model. But if you're going for cases or probability of a certain number of cases or something like that, then if really the disease is quite rare where you are, it might be a challenge to model that. So you might, I'm thinking about places like the southern parts of the US where we do have travel cases of something like dengue, and local transmission is usually typically pretty limited. Then you might be interested in modeling environmental suitability, just understanding what's happening with the vector in case the disease is the virus is introduced. But I think whether you use a mechanistic or a statistical model, it can be challenging, I think, in either case with such a limited number of cases. But the one requirement of a statistical model that's really helpful, at least, is having a lot of data. So you might have a lot of data in terms of the independent variables that could help drive your model. So difficult question to answer, but I think, and the research team might have a good answer for this too, because they probably experimented with both kinds, but you don't have to choose either. It's possible to to develop these models together, and there are new approaches like hierarchical Bayesian models that can actually combine these different concepts. So it can sometimes be a false choice. You don't have to necessarily treat it as a strict dichotomy.
From SIMPA, I know Paola even mentioned how here in Costa Rica you do have areas where tourists come in and maybe the cases don't get reported there because it's when they go back home that maybe in their country that's when the dengue cases get reported. So do you have any follow-up to this or to the question in general?
Go ahead, Paola.
Go ahead, Liz. Sorry.
Okay. No, I just want to mention the same idea of Hunter that Hunter said before. I think we as a team, we have considered the modeling of both kind of approaches, the mechanistic approach and the statistical approach. And we have found several advantages on both approaches. For example, in the mechanistic way to model the data, to model the problems. Well, all depends on the research question as first, and also it's a good way to understand the dynamics of any disease. For example, dengue, Zika, even COVID, and also the impact of sanitary measures is a good way to understand how the things move in a short term. But in terms of the statistical modeling, I think the uncertainty quantification it can be considered in this kind of approach, and it's a good way to understand the uncertainty if you define the errors in a proper way, and also the speed of computation of course. If you compare the mechanistic models and the statistical models, you can have a good advantage if you use a statistical way in terms of speed of computation. I don't know if Fabio wants to add something there.
Yes, I just wanted to add something very briefly. I think both ways are separately are good ways depending on the research question, but also the way many people have done it, and we have done it ourselves, is to combine both ways, the statistical and mechanistical way of approaching these problems. But one thing that is very often overlooked is the social aspect of these diseases. We're so used to our routines of, we get influenza every year, we get dengue every year, or the intensity of the outbreak varies, and it's somewhat cyclical in many places where it's endemic, but we're used to the same. Dengue season starts in Costa Rica in May, when the rainy season starts, more or less around that time. It lasts for about 6 months, and it's year over year, it's the same thing. But and we model it typically the same way. But what happens when something like COVID shows up? Everything that we have done in the past to model these infectious diseases it doesn't work, because the social aspect and the sanitary measures that have taken place have changed the behavior of the population completely in every country, and not homogeneous in every country. So that aspect is very important. When we started modeling COVID, we used the typical SIR models. We didn't know much about the disease, just like everybody else in the world. But those models stopped working after 2 weeks of the virus getting to Costa Rica, because of the sanitary measures, the panic of the population. The mobility started being very different. And then we had to sort of like move to a different approach where we can incorporate or try to incorporate those behavioral changes at the population level. So I think both approaches are very useful, but also we have to take into account these are social diseases. The virus doesn't move on its own. In this case, vectors move the virus and people move the virus. In terms of COVID, people move the virus. COVID doesn't move on its own. It's people that move the virus. So the social aspect is actually a very important, and that's why we work with Programa Estado de la Nación in Costa Rica, they have tons of social and social demographic variables, and we want to incorporate that as well as climate variables to try to better understand these diseases and try to provide practical solutions to public health authorities.
Thank you for this. This has been very, very insightful. Just going back to a question for Hunter that just came up. For developing countries, climate predictions would be an alternative for vector surveillance. And then they ask, mostly in my country, adulticide control is carried out in the face of the increase in cases. There are no prevention policies. And this is actually, yeah, from a question from a participant from Peru.
Yeah, I mean, it's a good point that they're making. You know, you have to kind of work with what you have. And I think one of the examples I gave when I had that slide up of the different kinds of outcomes that you could predict, the one on the far left was from IRI, the International Research Institute, and it was just predicting suitability. So that was a prediction for Africa, and it was just showing that even in cases where you don't necessarily have complete surveillance data, you might be able to use other things like environmental suitability. So yeah, that's a good point.
Thank you. And just one general question that was asked, like, and I think it may be for Simpa, but Hunter, if you also want to answer after. It says, what kind of specific data did you use from the Meteorological Service for this modeling? So I think it may have been for Simpa.
Yes, we use data from meteorological stations that was provided by the National Meteorological Institute. And it was located in the five municipalities that we chose. So it was data from meteorological institutes, would include temperature, precipitation, and humidity for 2007 to 2017.
Thank you. So I'm trying to see what else we have here, and I guess we do have one question, and it's for Hunter. And it's interesting because it's about Costa Rica, but maybe the Simpa team can also provide us some insight. So why is the risk of chikungunya in Costa Rica so high?
Yeah, so I think they're referring to that slide I showed of the experimental product of chip risk, and I didn't work on developing that product. I was showing it as an example. So it's a good question that I would take back to the team that's working on that. But I know it's, I would say that that's still an experimental prediction. So that's kind of thing that would need to be calibrated against what's actually happening. So yeah, I wish I had a clear answer to that, but that is a good question that I could bring back to that team.
Yeah, Paola, please.
Yes. Chikungunya in Costa Rica started, I think it was 2014, but the risk of chikungunya is not as high. Actually, dengue is the vector-borne disease that circulates the most in the country. We have cases, but not as much cases as we have with dengue.
And that might have been showing relative risk, so it might have been relative to what is a baseline expectation, which of course might be low. So.
Yes, exactly. Yeah.
Well, we do want to be mindful of everyone's time, and I think before we, move to final remarks, we would love to have a memory of today's event and everyone's participation. So we ask if possible, and I think a lot of people may be familiarized with this, is we ask if possible if everybody can turn on their cameras so we can take a couple of screenshots and have a nice memory of today's event and see also your lovely faces and your smiles. So I know Gabriela and Pamela and Talia may be helping with taking the screenshots, so I can see, are there some, I can see some people lit up. Thank you so much. So, and if you can't turn on your camera, always send out a shout out at using the general chat. So I'll go ahead, I guess, and do a small countdown. So how about that? So 3, 2, 1, everybody. Yay. Thank you so much. And okay, so on behalf of the Regional Environment Hub for Central America and the Caribbean, the State Department Office of International Health and Biodefense, and NOAA, we want to thank you for participating in today's webinar. We also want to thank our speakers, Hunter Jones from NOAA, and from SIMPA, Dr. Paola Vasquez, Dr. Fabio Sanchez, and Dr. Luis Barbosa. I also want to thank our team that were helping us behind the scenes, Gabriel, Talia, and Pamela from the Hub, Meredith. And also we want to thank our public affairs team that helped us with facilitating this, and our interpreters for today. And also I want to give a shout out to the office in DC. Thank you for your support in all of this. We will follow up via email with an evaluation survey. And any questions that may have left pending, we will also reach out to our speakers so they could provide us with. We will be including our speakers' contact information in the event you want to reach out to them. We feel this is very important, and we hope that out of here today, some emerging collaborations or exciting collaborations emerge. We hope today is the start of, like I mentioned, new collaborations, and we hope that climate predictive services as they relate to vector-borne diseases is something you or your institution or the office you work for explores implementing. We also hope this webinar is the first of many more to come, and we hope this is not the last time we see you. So thank you all for everything, and until next time.